Lots of international students have this question in their mind: what things are covered and not covered in their overseas student health cover? And obviously, if you're getting this insurance, you should know what things are covered and not covered. So in this video, we are going to discuss about the things that are covered and not covered in overseas student health cover. It's important to note that this video will be a general guide. Now you need to make sure that you read the overseas student health cover deed, which will list out all the terms and conditions for what things are covered and not covered in your insurance. So first thing first, what is OSHC? OSHC stands for Overseas Student Health Cover. As the name suggests, it is an insurance cover for international students who are coming to study here in Australia. If you are coming to Australia on a student visa, you must have this insurance before arriving into Australia. Now, there are some students from certain countries who are exempt from this overseas student health cover, which means they don't need to take on this insurance. That includes students from Belgium, Sweden, and Norway. So if you are students from these countries, you do not need to take this insurance, but other students from other countries must take this insurance if you're coming here for your studies. So how many providers of overseas student health cover are there? At the moment, there are 6 providers of overseas student health cover in Australia. These are AHM, Allianz, Bupa, CBHS, Medibank, and NIB. As an international student, you obviously have a right to choose your own overseas student health cover provider. So don't just take a word of your agent, you can certainly choose your own medical cover. So let's talk about what are the things that are actually covered in your insurance. So the first main one is hospital expenses. So your hospital expenses in a public hospital is usually covered in this insurance. So any cost of treatment, any accommodation, and any outpatient cost are usually covered in your overseas student health cover. So if you have to go and attend a hospital, especially the public hospital, then you are usually covered under your insurance. Now the next thing that's covered is the cost of general practitioners, also known as GPs, and some specialist consultation fees as well. So not talking about hospital, but now if you're going to a regular clinic for your health checkup, having a consultation with GP is usually covered under your overseas student health cover. Most of the insurers would cover 100% of these consultation fees with the GP. Now with the specialist consultation fee, there may be certain percentages or you might be partially covered for these expenses. So it means that you may not be fully covered for the specialist consultation fees. The next thing is the cost of medical drugs. So any medicines that are prescribed by your doctor are usually covered under health insurance. Please be mindful that there will be a certain limits on how much money you can claim under these medical expenses, as there are prescribed limits by your health cover insurance providers. The next thing is ambulance cover. Ambulance is covered under overseas student health cover, now which means that if you need to call ambulance in an emergency situation, then you are covered for those expenses. Just make sure that you're calling ambulance just for emergency purposes. The next one that's covered is COVID-19 related illness as well. Now, overseas student health cover providers have confirmed that international students are covered for COVID-19 related illnesses, principally lung and chest, kidney and bladder, and dialysis for chronic kidney failures. And last but not the least, the thing that's covered is implant prosthesis. So prosthesis means any artificial limbs or body parts that you may need to get it done because of an accident or some other reason in Australia. You're usually covered for the 100% of the benefit for any surgically implanted prosthesis. Now let's look at the things that are not actually covered in your overseas student health cover. First thing first is cosmetic surgeries. So any sort of cosmetic, beauty or eye surgeries, they are not included in your overseas student health cover, which means you'll have to pay money for these expenses out of your own pocket. The next one is extras. So any extras such as dental, optical, physio, chiro, or osteo, they are not usually covered in your overseas student health cover. The good thing though is that you can buy additional coverage for these extras in case you need them. Obviously, if you are going to take these extras in your insurance, it will mean that your premium will be higher. But sometimes it's worth the expense, especially if you know that you will need these services. Because services like dental can be really expensive here in Australia. The next thing that's not covered is any treatment that you have done outside Australia. So any sort of treatment that you do it outside Australia, whether before or after coming in Australia, they are not covered in your health insurance. The next one is infertility treatments. So any sort of fertility programs like IVF or ARS or any other treatment related to infertility will not be covered in this insurance. Last but not the least, the compensations as well. So if your treatment is covered by any sort of other compensation scheme, like for example workers compensation scheme, then your overseas student health cover will not cover that, because obviously it will be covered by other type of insurance. Now apart from this, very important to note that there are some waiting periods for certain type of medical treatments as well. So there is a 2-month waiting period for pre-existing psychiatric conditions, 12-month waiting period for pre-existing conditions. So if you have certain conditions already, so you'll have to wait the treatment for that for at least 12 months, and 12 months for pregnancy related conditions, which is very important to note for the students who are coming on spouse visas as well, that you have to wait for at least 12 months for your pregnancy related conditions. And it is important to note that the couple's overseas student health cover insurance is usually much higher because of this reason as well. As I mentioned earlier, it is important to check what are the specific conditions that your insurance have as well. Sometimes they may cover some additional things as well in the insurances, and some may not. So it's very important to do your research before choosing the right health insurance for yourself, because the chance is that you might need to use it after coming into Australia. Now obviously we have got a very detailed article, and we got this information in our overseas students guide as well. So if you want to download them, please check the link in the description. We'll also make sure that we put some additional useful links in the description below. So as always, check them out. And if you find any value in today's video, make sure to share it with your friends as well, as it really helps to soothe my throat. I'm not feeling that well. Anyways, thanks for watching. See you in the next one. Lots of international students will mean your premium will be